Yes, Sprinkbank Ward is a personality disorder unit for women, and we had about 2 to 10 times the number of incidents per month than other units across the trust. There was a lot of physical restraint, there was a lot of rapid tranquilization. We deal with very complex patients that come to us from all over the country, and at that time the best use of the best management techniques we had was to use restrictive practices to try to control behavior. There were several changes that happened across time to change things on the ward, and they have changed massively. I guess that the key things that we had to do was to improve the environment of the ward, to improve the relationships between staff and between staff and patients, and to improve the ward program, the therapeutic program that we deliver. We did quite a lot of co-production, so we worked very closely with patients to see what they thought the problems were, and we acted on what they thought was a problem. For example, there were a lot of rules in place at the time. We had no smoking past 11 o'clock at night. And one patient said, well, why can't I smoke after 11 o'clock at night? I'm an adult. And that was generating a lot of debates between patients and staff. So we got rid of that rule, and instead we replaced it with a value, which was respect. And if you went out to smoke at night, you were in the courtyard next to other people's rooms. You had to be quiet, and you shouldn't be talking very loudly because it would wake people up. So we moved from a rule-based system to a value-based system, focusing on respect, safety and recovery.
And what were the results in those changes that you oversaw at Sprinkbank Ward?
So over time, and within the first 3 or 4 months after several of the changes we made, we saw our incident rates drop to on par with the rest of the trust average, and we have been below average now for the last 6 months. So we have maintained low incident rates for over 3 years, and there's only been 1 incident of rapid tranquilization in the last 3 years, whereas we used to have about between 60 and 100 per year. And that 1 incident in the last 3 years was out of hours, and it wasn't our staff. So it's been a massive change. We also collect data on symptoms and on how patients recover, and all the data we have, the difference between admission and discharge is huge, and we follow up people for 6 months, and that difference remains. So we get people from being completely outside of the norm to coming in within normal values of whichever measure we take, and that benefit is maintained 6 months down the line. I think this initiative is fantastic. I hadn't heard of it until when Sarah invited me, but I think it's fantastic. I'm fully supportive of it. I see patients coming from units all across the country complaining about the restrictive interventions they have had to experience in these units. And so if we can change things for patients, I think it's a fantastic initiative, and I'm very happy to support it in any way I can.